selecting the six-pack abdominal creation type patient is very important because you can't take a obese patient with intra-abdominal fat and you can't create the six-pack, it won't look good. So ideal patient should be almost ideal weight. He's struggling to create a six-pack even though he does the exercise and diet. Those are the people ideal. In this patient, if you see, he has a already existing good musculature, only the fat over that area is not allowing him to give the refined look. And the marking of the six-pack is very simple. It's like when you know the six-pack anatomy, it's easy to mark it. But the marking, you have to understand, it's not a one line. You have to at least keep at 1.5 centimeter thick line so that, like when the skin goes down, the pack looks very visible. And normally it's not 6 packs, almost 8 packs. Some people even you can see a 10 packs. But the same time you understand both the lines, that horizontal lines won't be in a same line. That mistakes a lot of people they do it. They try to create the line in the exact same horizontal way, but actually not. Little bit above and below will be the ideal way to do it. We have to check how the lines are located for him. See, some people when they in the standing position itself, they tighten the muscle and show. Those are the very ideal people for this kind of a surgery. Some people, you have to make them lie down and they have to contract the muscle by doing the head rising or leg rising. Then you do the marking of the lines. And same way, the parallel, the rectus side borders, that also you have to mark it. So why we are keeping the rectus side border marking is more thicker like a line, because those are all the areas called shadow areas. Shadow areas, if you do a extensive liposuction, superficial and deep, then only that lines becomes more darker in the silhouette photographs. Like you see the model, they'll create the shadows very, very good way so that pack looks really nice. And same way, where the internal oblique, external oblique, actually that line starts from the anterior superior iliac spine, goes all the way up to the armpit. So that line also important, that gives a kind of a defined look. So left side I mark it thicker, the right side also the line is marked. So these are all the lines you need to be concentrating in the six-pack marking. In this case, we are doing a pectoral etching also. I am not doing a complete gynecomastia surgery. I am doing only the pectoral etching in this case. So the plan is we do liposuction of the lower back by making 2 small cuts in the buttock region and do the liposuction of the lower back. And when you're doing a liposuction of the lower back, the V shape you have to keep it in mind. The boys will have a V shape. The girls, we need to keep a curvy thing. So boys, that V shape you have to keep it in mind. So now we are starting the liposuction of the lower back. We started with the infiltration and then we use the Vaser. After Vaser, use the power assister to remove the fat in the lower back and we will give the V shape appearance. And you have to remember the liposuction of the lower back. One point is, it is not only the deep fat, there is a superficial fat and deep fat. In liposuction of the lower back, usually people miss the deeper fat compartment. So you have to go closer to the muscles and remove the deep fat as well when you're doing a lower back liposuction on the side of the lower liposuction. So once you finish, you close the wound and keep the foam pads and put a tenoplast dressing. Then we'll turn them and we start our six-pack creation. So the difference between our technique and various other technique is, so in this technique we make only 2 cuts below your undergarment level. We make 2 cuts and the lateral rectus border. Usually people make multiple cuts, like for each horizontal line they go closer to the horizontal lines and make 1 cut in each side. Here and here and here and here they make multiple cuts, as well as in the navel region they make 1 cut to recreate the midline. But without making these cuts, I am making 1 cut here parallel to the lateral rectal border and 1 cut here. With that we are creating this six-pack lines. And now since we have the pectoral etching procedure also, 1 cut in the armpit, another cut in the other side armpit, and same using that I am creating the upper horizontal lines also without making a cut in that region also. So in this way we can avoid multiple cuts with only 2 cuts and the pectoral etching cuts which goes under the armpit. All these cuts won't be visible at all. So in that way we are creating the 6 packs. So when you are creating the 6 packs, the infiltration, you have to remember one thing. Wherever you are doing a etching procedure, make sure that you are infiltrating the superficial as well as the deep plane very well. And when you are doing a Vaser, you remember one thing, if you want to create a line, you give a pressure over the 4 fingers in that line and keep moving your vaser in that area alone, so that your superficial and deep fat, both the compartments are addressed with that maneuver. So all the lines, if you follow this, not only for the vaser, even the micro liposuction, you follow the same way and remove the fat. You need to be very gentle, cautious, because when you're doing so much of superficial, you end up in a burn. So you have to balance it. So first I start with the midline etching. I use a vaser. Now I'm using the micro to create the midline etching. Once you finish the midline etching, you can see our fingers. We are giving a compression over the midline, and we are keep moving our vaser probe, then our micro probe, so that area alone, superficial and deep fats are addressed and completely removed. So once you finish the midline, the other horizontal lines, each one I address it slowly. Only thing is, you need to have a very good control over the cannula and slowly move that cannula, so that only you address the horizontal lines. So we finished this horizontal line, we are going to the second one, then third one, then fourth one, the same way. Once you finish the vaser, then same way you use a micro air to remove the horizontal lines and do the suction using the micro air. So then we create the lateral rectus border, creating the negative spaces in the lateral rectal border. So then we'll do the pectoral etching and as well as the upper horizontal line using the vaser as well as the power assistant. So this way we create the six-pack creation without making a multiple cuts. And after that, you keep the foam pads in the lines, horizontal as well as the vertical lines, and as well as the chest, as well as the side of the tummy. You keep that and put a Dynaplast and keep it for 3-4 days, as long as possible. Once you remove that Dynaplast after 4 days, it looks very good because of the compression of the foam. It looks really good. But you give them some more pads and make sure that they'll stick it, and every day they'll remove the pad and again apply the pad over the line for at least 2 weeks. After 2 weeks, this is not practically possible. So we ask them to wear the pressure garment for the period of 1 month to 1.5 months. And the lifestyle, maintaining the diet and starting the exercise as early as possible. I think normally after 2 weeks, I allow them to start the cardio workout, and after 1 month, I allow them to do all the muscle workout. So this is our post-operative instructions and follow-up. And if you have any queries, don't hesitate to mail me or leave a comment here. We can help you.